Good morning, everybody, and a very, very warm welcome to you indeed for day 2 of the conference. And first, I want to acknowledge the Kaurna people of the Adelaide Plains as the traditional owners of the lands on which this conference is being held. And I acknowledge the traditional owners of the many lands from which our virtual participants are joining us. I pay my respects to their elders past and present, and to First Nation elders and members of other communities who may be here either in person or online. Now I would like to introduce our first speaker of the day, Maree McCabe, AM, Chair of the Aged Care Quality and Safety Advisory Council and outgoing CEO of Dementia Australia. Maree brings extensive experience and expertise to the health, to the mental health and aged care sectors. Her career accomplishments include leading the former Federation of Alzheimer's Australia to unify and become Dementia Australia. So please welcome to the stage Maree McCabe.
Thank you so much, and good morning, everyone. It is so great to be here with you. And I acknowledge the traditional owners of the lands on which we're meeting today, the Kaurna people, and pay respects to elders past and present, and to any Aboriginal and Torres Strait Islanders present with us today. And I welcome everybody that's joining us online. And I hope you enjoyed the dinner last night. It was lovely to catch up with some people and have a chat, and I look forward to catching up more with other people in the breaks. Now, I'm sure that you will agree that this national conference is a fantastic way to hear from, to engage directly with the Commission, and also share our thoughts and ideas, and to network with colleagues. And Janet, my thanks to you and the team of the Commission for organising this conference. I know the months that have gone into the preparation, and it has been absolutely wonderful, and the feedback from yesterday was fantastic. So please give Janet and the team a round of applause and acknowledgement. Colleagues, we work in a sector, and you well know, that has been under the spotlight since before the Royal Commission, and certainly the glare has been intense over the past 5 years. And it certainly hasn't been comfortable, and quite the contrary on occasion. And we are, after all, part of an ageing society, not just nationally but globally. And I think for the first time in Australia, we have more people over the age of 65 than under the age of 15. The number and proportion of older people in Australia continues to grow, and we as a country will continue to work to improve how we support older Australians, ensuring that they continue to enjoy the best life possible right to the end of their lives. Certainly that's what the Royal Commission concluded, and that's what older people have the right to expect. And all of us at the conference understand the need for ongoing improvement in the work that we do. We all have direct and valuable experience and insight through our work, through our family, and through our friends. And if I said now that it's an exciting time to be working in aged care, some of you might query my choice of words and say that it's a bit daunting. But it's certainly true that there are lots of reforms, and it's also the case that older people have been waiting a long time for some of these improvements, and others see it absolutely essential. Now, I do want to say congratulations to you. This has been an extraordinary time in aged care. And I know that there have been a number of reforms that you have implemented. I mean, there's the 200 minutes of care, the 24/7 RNs, there's SIRS, there are so many, and now the Aged Care Act is coming into play. And I really thank and acknowledge you for the extraordinary work that you have done. And I do also acknowledge the incredible pressure that you've been under in implementing those reforms. So congratulations. You should give yourselves a round of applause. I think it's truly amazing. If I had to single out one I think probably the biggest impact to date would be the wage increase for aged care workers. Now, I know that that's been a game changer and long awaited in the aged care sector. Arguably, the most significant and extensive reform of all is still coming in form of the new rights, I can't get this right myself, the new Rights-Based Aged Care Act. And this Act is fundamental to achieving the reforms recommended by the Royal Commission and is certainly a vital framework for this change. And central to providers' delivery of safer, higher quality care that meets expectations will be our engagement, our listening and our co-design with each older person in our care. This conference is a fabulous opportunity for us to explore together in depth key implications of the changes that will be introduced in the new Rights-Based Act, things like the new arrangements for market entry and market participation, involving a process in which providers will register in a particular category, and those categories have specific obligations that will apply to them. Now, for some registration categories, these regulations will include complying with new strengthened quality aged care standards, and all of these arrangements will be part of a new regulatory model in which the Commission will continue to play a central role. My reference to the regulation of the sector is a useful segue to the work of the Aged Care Quality and Safety Advisory Council that I have the privilege of chairing. The Advisory Council is a body established in legislation under the Commissions Act with responsibility to advise the Commissioner on the performance of statutory functions and to advise the Minister on these matters at request. Now, membership of the Council, I think you may know, is currently being reviewed, and I take this opportunity to acknowledge our outgoing members wholeheartedly for your incredible and valuable contribution to the Advisory Council's work. And I look forward to welcoming new members soon. And our outgoing members are Carol Ann Barkla, Professor Sue Curl, and Sue's with us at the conference, and also Andrea Coote. If you would join me in acknowledging them and their participation. Thank you. Now, some of the members of the Advisory Council are attending the conference and we're wearing red lanyards, so please come and, if there's some feedback that you'd like to give or just to catch up, please do come and make sure that you catch up with us. The Advisory Council meets 6 times a year, and our meetings provide an opportunity for us to hear from the Commissioner on recent achievements, current activities and priorities as well, and on also the Commission's performance. We also consider and provide advice on a range of other matters. We do a deep dive into at least one particular area of activity at each of our meetings, for example, complaints handling, quality and safety monitoring, assessment and auditing, SIRS, or financial and prudential regulatory activities. A second tranche of activities undertaken by the Council involves discussing with the Commissioner and executives the Commission's findings, insights, conclusions and actions arising from its sector surveillance, risk assessment and regulatory processes. Our third general category of work is to contribute to planning and review exercises that surround the development and publication of the Commission's corporate and operational plans and annual report. The work of the Commission and the Advisory Council continues to evolve and is informed by the Capability Review. Now, the independent Capability Review of the Commission undertaken by Mr David Tune, AO PSM, which was released by Minister Wells in July 23, made 32 recommendations. While the government hasn't yet released its formal response, which I understand is being finalised in the context of the budget, the Advisory Council has been briefed on and has discussed with the Commissioner the significant work underway across the Commission to address the issues identified in the Tune Review. Now, that work to lift the Commission's capability in key areas is also vital to the Commission's effectiveness in preparing itself and the sector for the introduction of the new Act, including how to achieve a greater level of transparency by the Commission in its operations. In relation to the Advisory Council Recommendation 6.2 of the Tune Review, this recommended that the Aged Care Quality and Safety Advisory Council be strengthened to provide stronger independence, accountability and oversight. And the Advisory Council is working diligently on this recommendation in particular and its implications in great depth. We've also discussed how we can best realise this recommendation with the Commissioner, the Department and Aged Care, and pivotally, we've met with Minister Wells to understand her expectations of the Advisory Council. We're very clear that the Minister wants the Advisory Council to help build greater trust and confidence in the Commission by standing apart from it and providing well-informed, independent advice and guidance to the Commissioner as well as to the Minister. We're certainly ready and able to do this and very keen to step into this stronger role. One way of achieving this will be to enhance the Advisory Council's direct engagement with stakeholders, with providers and with older people receiving care. And this engagement will be a core part of our work plan going forward. We will continue to support Janet as Commissioner to achieve the impact across the sector that she and her team aspire to and that all Australians expect. I know that we all share the same goal. We all want a thriving aged care sector staffed by skilled, competent, highly motivated workers who enable and support older Australians to enjoy the best possible quality of life to the end of their days. It really is a privilege to chair the Advisory Council and to play a role in striving for the continuous improvement across the aged care sector that we all know is vital not just for the future of aged care, but most importantly to the well-being of older Australians across the country. Now, on a personal note, many of you will be aware that after 13 years across Alzheimer's Australia Vic and Dementia Australia, I am stepping down as the CEO of Dementia Australia. And in fact, today is my last day in the role. And being CEO of Dementia Australia has been such an enormous honour. And I extend my profound appreciation to each of you that I have had the privilege of working with, including people of all ages living with all forms of dementia, their families and their carers, along with the extraordinary team at Dementia Australia, our supporters, and to you, my colleagues across the sector. The incoming CEO is Professor Tanya Buchanan, and Tanya brings a wealth of experience to the role, including her most recently role as CEO of Cancer Council Australia, and I know that the sector will welcome her. In closing, thank you for everything that you do in providing care and services to older Australians and to your commitment to excellence. And I thank your staff, and I thank everybody in aged care that works to make a profound and lasting difference to the lives of older Australians. Thank you so much.
I'm now very pleased to be able to introduce Michael Lai, the Deputy Secretary from the Department of Health and Aged Care. Michael joined the department in December 2019 as the Deputy Secretary responsible for ageing and aged care. And he's led extensive reforms to the Commonwealth Aged Care Program. And Michael is also the Senior Indigenous Champion for the department. Prior to joining the department, Michael held senior executive positions at the Department of Social Services, including as Deputy Secretary. Would you now please welcome to the stage Michael Lai.
Thanks very much, Richard. And if I could begin by acknowledging the traditional owners of the land we're meeting today, the Kaurna people. And can I also give a big warm welcome to Aboriginal and Torres Strait Islander peoples joining us today at the Convention Centre and online. You're most welcome. Can I also acknowledge both Janet Anderson and Maree McCabe, who've kindly invited me to speak today, and acknowledge Maree's contribution to dementia. She's been a fierce but fair advocate for the rights of older people, and I've really appreciated both that advocacy that she's given and also her guidance as we've gone about the reform of aged care. So thank you, Maree. It's a pleasure to see so many people here. And I know that it's been an enormous amount of hard work put in by the people present in this room to make sure that older people are getting the services that they deserve. The Royal Commission described an aged care system that was plagued with issues that were having very serious consequences for individuals, up to and including avoidable deaths. The problems began from the moment that someone attempted to engage with the aged care system, with the Royal Commission finding that applicants universally rated it difficult, irrespective of their background, and it just got worse from there. I want to acknowledge that we share responsibility for that system that we're now seeking to fix. And when I say share, I mean the Department of Health and Aged Care. And turning the ship around has been an ambition of our department, and so we welcome the findings of the Royal Commission report, however bracing they were. And we have worked diligently with government to first consider its recommendations and then to consider how to implement them. And now, 3 years on from the Royal Commission handed down its report, it seems like an appropriate time to take stock and reflect on where we have come from and where we're going. In the past, our aged care system was firmly in the realm of crisis, I think it's fair to say. The signs were everywhere and were plain to see by anyone who cared to look. At its heart was a funding model that was slowly strangling services and the viability of our aged care providers. While the funding model was slowly eroding the foundations of the sector, the dark irony was that this was occurring at a time when community expectations about quality of care were rising sharply. Award wages were lower than they should have been, and this led to staff not being attracted to the sector. Inadequate funding led to inadequate levels of care for residents in aged care homes. Inadequate care led to diminishing wellbeing, safety and quality of life, and diminished quality of life inevitably led to diminished dignity, self-respect and self-agency for older people. Stretched resources meant that providers were sometimes unable to supply adequate nutrition, causing health problems that staff members were not trained to manage. This impacted the quality of medical care, medication management and overall support. And that isn't even addressing the mental health issues that arose through isolation or the distress that was caused by our collective aspiration to protect and promote the rights of older people in our care. Then the pandemic came and put an unbearable pressure on a system that was already past breaking point. The toll that COVID took on the aged care system in the days prior to the vaccine rollout was measured in precious lives lost. These are things that we never want to experience again. I could continue, but you all know the story. Most of you, particularly during COVID, were in the trenches fighting to keep the system afloat. So that was then. It's a bracing story. But what about now? I really believe that things have begun to turn around due to the hard work and collaboration between governments, the department, providers, the Commission, consumer advocates, and most importantly, older people themselves. At her address in the National Press Club last year, the Minister for Aged Care, Annika Wells, mentioned that she felt like we have been triaging the aged care system to save what we could. I think we've moved beyond that now. We're starting to see some real results from our collective efforts. These green shoots take many forms, but you could broadly categorise them as improvements to quality of care, improvements of access to information, improvements to quality of life, not just for older people, but for workers who care for them as well. The 15% increase in pay across the sector, which Maree drew reference to, worth around $11.3 billion, that is bringing new staff to the sector, while helping to retain existing staff as well. Anecdotally, we've also heard from some providers that workers who previously left their jobs have also been returning, a heartening sign and a strong indicator of positive change. It's also worth noting that work on the aged care work value case is still ongoing, and so further pay rises are on the horizon. We've begun to make inroads into lifting the standard of care across the sector through things like having registered nurses on site 24/7 to provide clinical care and reduce unnecessary trips to hospital. By meeting our initial 200 minutes of care target across the sector to ensure that people receive an appropriate amount of daily contact with care workers, nurses and support staff. And introducing publicly visible indicators of quality like star ratings. Our figures tell us that aged care residents are now receiving an additional 3.6 million minutes of direct care every single day, an enormous achievement. That's roughly an extra 20 minutes each. And that is across the sector. And registered nurses are now on site 99% of the time, or 23 hours and 42 minutes per day. A vast improvement, albeit one that is just shy of our goal. We know that in some cases, these milestones may have been hard for providers to reach, and we have worked closely with those who have approached us and asked for assistance to meet the new standards. We've also established the Food, Nutrition and Dining Hotline so that residents, carers and their families can get advice, or complain if needs be, about the quality and nutritional value of their food. Initiatives like this may seem small fry compared to some of the larger moving parts at play in the sector, like the forthcoming new Act or the upcoming Support at Home program. But simply knowing that there's a channel for them to raise concerns if they keep being served substandard food makes a tremendous difference to people. It's the difference between being and not being heard, and it's initiatives like this that contribute to confidence in the sector. We're seeing more green shoots when it comes to people enjoying genuinely informed choice about what kind of care they are after and who is best suited to provide it, through measures like Dollars to Care and improved Find a Provider tool and star ratings. Things like increased transparency about what service providers such as yourselves deliver, what you are spending money on, and what the overall self-reported experience of your residents is. The Minister mentioned the success of star ratings during her opening remarks for the conference. It's an excellent example of the principles that we're applying as we implement reforms, because star ratings do not just increase transparency, they also increase competition to provide better quality services over time. And we know this is happening because we keep seeing aged care homes work to improve their ratings. We have also put in place measures to make it easier for people to navigate their initial engagement with the system through things like face-to-face support in Services Australia service centres. There are many more programs and initiatives that I could mention, but the key thing to note is that each of them is intended to address the system deficiencies that I spoke about earlier. And I want to reiterate that as we go through this very large period of change, which is difficult, that the department is here to support you through these changes. And one of the tangible things that we have done is to expand our presence outside of the major cities, to provide regional stewardship by setting up regional offices that can work with local providers to help them resolve issues. Places like Launceston and Alice Springs, and here in South Australia, a new office at Port Augusta. We're not the only ones who have noticed things beginning to turn around. We have been hearing it directly from providers and directly from older people receiving aged care. Our most recent residents' experience survey indicated that residents were more satisfied with the quality of their aged care in 2023 than they were in 2022, a trend that we expect to see replicated this year. We found similar results across a number of different areas where people reported being happier because they had a greater say about the things that affect them, such as daily activities, because they were encouraged to be independent and had better experiences with staff. Although still around 40% of residents thought that the food could be better, and so I encourage you to make use of the training by Maggie Beer and assessments from dietitians if your residents fall short in this cohort. Importantly, 85% of people that we surveyed said they would recommend their aged care home to someone they knew. This is not something that would have happened in the past. So we have more to do in the next 12 months, including a new Aged Care Act and a new supported home program that will replace some of our existing programs, and I would fully expect that at question time I'll get asked about those initiatives. And I want to reiterate that all of these things, the things that we're implementing now and the things to come, represent change, and as I said, it's difficult. It will soon be incumbent upon us to think about how to build on this stable base once we get there, and how to think about excellence in care. We'll get through the Act and support at home, I promise, first. But we do need to turn our minds to think about what excellence means, to think further on how to give older people in aged care the ability to direct their own lives, to create a more sophisticated understanding of what dignity for older people really means and looks like in the form of aged care services. And for people such as myself and Janet, and for you, to think deeply about how to engage and lead excellent services in aged care. So in closing, we're beginning to see some encouraging results from our collective efforts to reform the aged care system. The older people that are entrusted to your care as service providers are receiving more personal attention, greater access to clinical care, and are more able to hold providers to account for the services that they're provided than was the case just a few short years ago. We still have a long way to go, with some major planks of reform yet to be implemented, as the Minister highlighted in her address. But we're on our way. Collectively, we're turning the ship around and we're heading in a direction that is better than where we were before. We must not become complacent, but we should also acknowledge that it's taken hard work to get here, and hard work from all of you in this room. And I congratulate you on that, and I encourage you to stay the course. Thank you very much.
Well, thank you very much indeed, Michael, for sharing those insights into the thinking and the working of the department, a clear and very practical explanation. Now there is an opportunity for you to be able to ask some questions of Michael. Of course, you can submit questions via the conference app. And as I mentioned just a short time ago, if you are putting in a question via the conference app, please put that question in the section which says Plenary Welcome and Recap Day 1. If you're using the app, please do that. There are, of course, as we had yesterday, microphones available in the room at the top of the stairs here. And I'm just trying to see whether we have one down there or not at the moment. I can't quite see it, but there are certainly microphones at the top of the stairs if anyone wants to use those directly. Michael, let's begin. The first question actually is a pretty basic one that probably a lot of people are wanting to know. When will the government confirm the commencement date for the new Aged Care Act?
All difficult questions welcome. So I think that the government is very, very keen to see the Aged Care Act into the Parliament, debated, discussed, inquired into if necessary, and passed as soon as humanly possible. And so we're working very, very hard to turn not just, you've seen a lot of the Act in an exposure draft. There's obviously what we call subordinate legislation, which is regulations. And there's essentially a couple of missing chapters which represent the supported home program and fees and charges, so means testing elements. And so those are under active consideration by government, and the intention is to be able to make sure that people get access to the full bill, not just the large part of the bill that you've already seen and engaged on, as soon as humanly possible. So months, not years, would be my polite answer. That's the best answer I can give you. But there's certainly a degree of urgency, and we've heard very strongly in the department about people's anxiety to see the Aged Care Act passed. We've welcomed people's constructive feedback on the Act. There's obviously some things in the exposure draft that people really like, and there's things that people think need to be amended, and we're going through that process of looking at all that feedback that you've given us, and to ask the government to consider whether we need to make changes to what you've already seen. So, yeah, high degree of urgency.
Thank you. Another question that's come in through the app. The sector continues to have major recruitment and retention issues, which may undermine reforms such as care minute targets and the new standards. Is the department working with the sector to measure and address this structural problem?
Look, the short answer is yes. Can I just say that the sector's done an amazing job in terms of 24/7 and care minutes, despite the fact that we know that there is some unevenness in the supply of workforce. There's definitely some structural issues. Our intelligence and data tells us that the Fair Work Commission wages uplift has been an absolute game changer in terms of the workforce issues that people have faced. It has enabled people to recruit and retain workers, and reduce reliance on agency staffing. But that's not a blanket issue. So you particularly get to outside of the capital cities, and you still have real issues around the labour force, and the department's paying particular attention to where we see that unevenness. And that's hard work. Part of the story is the work we're doing with our colleagues in the NDIS and indeed in the health sector to think about how do we make it viable to bring a physio in full time to a Broken Hill or another regional setting. How do we think about it across those care sectors? Because the only way in the long run that we're going to get access to those kind of more specialist positions. But indeed, we've got the same issue with RNs and even PCWs in some locations, and so we're paying particular attention to that. But I would underscore that if you have been reluctant to test the market since the Fair Work Commission decision, or indeed post the next phase of this, get out there, because the experience that we're seeing, we scrape SEEK data and the like, is very, very heartening.
Thank you. A very short and very straightforward question coming up next. With the introduction of the new expectations, would there be a review of funding for providers?
Look, I think it's fair to say that to deal with residential care first, the department's invested in some serious capability around an analysis of the market. We've invested with IHACPA, the independent prices, in looking at what's happening in terms of costs. And I think our answer to the question is that we can see in residential care that the amount of funding going to actual care is appropriate. So it is now actually covering people's costs. We can see that in the data that providers provide to us. It's clearly the case that in relation to everyday living and accommodation, the story is slightly different. And so the work of the task force, which is now being considered by government, goes to those two parts of residential aged care funding, where clearly we still have work to do. There's no doubt about that. And we understand that if we can't get the residential aged care sector, not just to break even, but to what we call investability, which is making a return that enables the provider to invest in the future of service delivery, that we're not going to get excellent care. We absolutely get that. And so we're committed to that. So we might, people might have a different view about where the funding shortfall is, but we're very clear about that we still have more work to do in that space, and it's under active consideration by government. Support at home, I think, is a different kettle of fish, and I think, one of the problems that we've got to pay attention to, both government and providers, is this is a very, very big growth area with the ageing population. There'll be huge volumes going forward, but as we've seen in the NDIS, we need to be very efficient. We have to have good systems. We need to pay attention to how we do best practice care, because over time, the margins that people might have seen in the supported home area will necessarily shrink. That's been the experience in NDIS. So that's a collective problem we've got to solve, but it's a welcome problem in the sense that we're not facing a shortage of people needing a service.
Next question, are we on track to start the single assessment tool and workforce from the 1st of July?
Look, the answer is that in relation to single assessment and indeed the contracting of our partners who do assessment work, that we're trying to stagger the introduction of these new arrangements. So we are on track, but we're paying particular attention to how do we stage these things. We're doing a similar thing with when we think about support at home, when we think about the Act. How do we give time for people to get across the new arrangements, start the task, and then and see if there's things that we can triage along the way to take some of the reform pressure off people. And so in that space, we've got a large number of things happening, but most particularly, people will be aware that we're out in the market around the contracting of and engagement with state governments around the future of that single assessment service. So I'll probably leave it at that, given that's live.
No, thank you.
Excuse me, Richard.
Actually, you touched on this a little in your presentation, but there's a question here about the new regional department hubs. What kind of support have they been providing? The question says, examples of what the department is doing out there in regional areas, please.
Yep. So, to pick an example, we've got a particular issue in the Illawarra. Patrick Reed's here, he might grab a microphone and start berating me about it, but there's definitely an issue in the Illawarra. We've got, they've got workforce issues, definitely. There's some capacity issues in the sense of not beds, but the ageing stock. We've got a large number of people in hospital who are long-stay hospital patients, and providers like Patrick and the local hospital district, the New South Wales Department of Health and ourselves have been engaged around how do we deal with this problem. Some of the issues are systemic, are national in nature, and some of them are local. And so Sarah Rumble, who's our New South Wales State Manager, has been working with our South East New South Wales Regional Office, and they've been engaged with that group of providers and with the state government directly, sitting down, going through, and in some cases going through patient by patient in the hospital to think about what have we got to change to get this right. And it's a tool in the form of these dedicated staff that we just haven't really had outside of capital cities. And so that's one example. We've got great examples across all jurisdictions. Gives us the ability to get in there at a very local level and work with people. And I would say it's not just to work with providers, it's to work as system stewards. And so that means that, if we see that there's a group of older people who are not getting a service because of some local factor, that we're prepared to engage with that group of people too, to make the system work.
Thank you. I gather there is a question on one of the auditorium microphones, and apologies if I've missed you before now, but the very bright lights make it hard to see people at the auditorium microphones.
Thank
Do
you.
we have somebody?
Yes, thank you.
Oh, great.
My name
you
is
are.
Jill. I'm from a small, not-for-profit residential aged care home in an MM5 area, so regional. I've been talking to other people around at the conference, and I know I'm not alone in this. I'd like to ask whether the department has a plan to address agency costs. In the past, there was one or two providers, you knew what you were getting, you knew what the costs were. Now we have lots of agency providers. The costs are extraordinary. We're buckling under the pressure of trying to meet the 24/7 and pay these agency costs. I was wondering if there was any plan to either control that or maybe provide some form of supplement that you could apply for.
Yeah, look, great question, and I think and can I just say to you that we see that in our data, that exact story it's a real thing, and everybody obviously understands that we don't want to have people in regions not getting 24/7 nursing and not getting care minutes, and I know providers don't want that either. And so where we do have these unevenness in the workforce or workforce shortages, we still have providers who have high agency dependence, and that is one of the critical factors that determines their breaking even or profitability or sustainability or not. I know it's not sufficient to say that the Fair Work Commission decision is the answer to that, but it is. Don't underestimate the enormous help that gives. But I do think in these areas we need to be much more surgical in working with you and identifying is it a cross-care health solution where we look to, as we have in some locations where we sort of say, let's think about the pool of health and care workers in this location as being available to all services in the community, and we try and see if we can roster to kind of accommodate that better, which is a kind of South Australian solution that we've kind of been piloting. Is it about providing short-term assistance to providers? And indeed, we're doing that in Alice Springs. We're actually providing financial support to help where it's very, very hard to get non-agency staff to come into that town at the moment. What I would say to you is that no option is off the table. It's a real issue. There'll be real limits to to the degree of support. It can't necessarily be open-ended, but one of the values of regional stewardship is us getting in and understanding your issues and seeing if we can sort them out, with the goal in mind of not do we retreat from the high level of care that we aspire to, but how do we help you manage the workforce issues, solve it, and in the meantime stay afloat. Great,
thank you very much. What will have to be our final our final question for this session. But unfortunately on the screen here, I was about to try and read the question. Great, thank you. Something has just changed on the screen, so I'm now able to do that. And it goes, with all these reform and constant changes, what is your view? As a care provider, we spend huge time documenting what is required from the Commission, which leaves us with very little time to provide direct care to our lovely residents.
Yeah, look, definitely an issue, and but can I say that there's unlikely in the short term to be any kind of public desire or anywhere desire to not have the accountability that we've put into the system because of where we've been. People need to understand that context. It's not going to, people aren't going to say, well, we're going to move away from the level of transparency that we've gone to. It's not realistic. But I think that the thing that we are tracking very strongly is how do we kind of think about helping you to be able to do that documentation without the extra red tape, without the extra handling, with it being highly manual. And so the very large investment that we're asking government to make in the ICT development to support the sector, we have our eye on trying to make that task as simple as it possibly can be for you, because we share your desire to be at the side of a resident, not documenting their circumstances, but engaging with them and helping them to determine their day. And so, be patient about that. I think we're at a point where we'd say the requirements certainly outstrip the sophistication of our collective ICT capacity, but we understand that and we're committed to sort of make that, to deal with that, because we totally we're with you. We want you by the side of the resident, not filling out forms.
Thank you. Thank you all very much indeed for that flood of questions. We have many more questions that I can actually see here, but time has defeated us. But thank you so much for being part of the conversation. And if we weren't able to get to your question, then hopefully that will be part of your continuing conversation as the day proceeds. But for all of those responses and for all of that analysis of the situation at the moment, would you now please thank Michael Lai?
Thank you.